So good evening and welcome everyone to this online session on coping with lung cancer, sexuality and body image. So my name is Alfonso Aguaron and I will be facilitating today's webinar. So today it is my pleasure to introduce to our speakers, to our participants. First, Fátima Castaño, who is psycho-oncologist and sexologist at the MD Anderson Cancer Center in Madrid, Spain, as well as psycho-oncologist in the Spanish group for people impacted by lung cancer in Spain, AEACaP. And also Merel Hennink, who is a good friend of Luce with a lot of positions, patient advocate, very active in Netherlands, in lung cancer in Netherlands, also in Europe as part of Cancer Patients Europe, an ambassador of Luce as well. But beyond that, was one patient since it was diagnosed in 2014. So she will be sharing her own personal experience, her insights during the session as well. So Fátima and Merel, I would like to thank you so much for being with us today and sharing your valuable time with us. So before we get started, I would really like to give you a brief overview on how the session is going to be managed. So first of all, Fátima will provide an introduction when she will touch base on the main topics around sexuality and body image when it comes to those impacted by lung cancer, patients, caregivers, and so on. And then we'll go through a little set of questions that you have sent us in advance, and also have a little dialogue with Fátima and with Merel. As this session is being streamed, just in case you have any comments, you can type them in the chat, or if you are following us on our social media channels where this session is going to be streamed, please feel free to make your comments. So being said that, and without further ado, I wish you all a very fruitful session. And Fátima, I give you the floor so you can start when you're ready.
Okay. Good afternoon, everyone. It's a pleasure to be here, and also thanks you for Luce to organizing this seminar with such a successful and interesting topic. We are going to talk about sexuality and body image during cancer treatment. And currently, when we talk about lung cancer, we are likely to talk about scientific advances, treatment development, also progressive increase in patient survival, which is related to an improvement of the quality of life and increasingly better functional recovery. And when we talk about functional recovery, we also want to talk about sexuality. Sexuality is so important for patients because it's closely related to a better psychological recovery after or during treatments. That's what are we talking about when we talk about sexuality? We are talking about not just about sex. We are talking about desire, pleasure, privacy, eroticism, individuality, couple. We are talking about capacity to enjoy with your body, to enjoy with your partner, and also to make enjoy. And the World Health Organization tells us that sexual health is fundamental to overall health and well-being of individuals, couples, and also families. So the importance of this vital area in human being is verified. Therefore, it is so important that to work to achieve the recovery of this function in lung cancer patients. Lung cancer impacts all the spheres of the human being. That's a reality. The patient and their relatives makes a big effort, sometimes titanic, to adapt to fear, to the disease, to the treatment, and to its sequels. Dealing with psychological coping is not easy. And in this context, what happens with sexuality? Sexuality is the most delicate of the human behavior. How it couldn't be affected by cancer and its consequences. During cancer treatment, sexuality may be affected by a lot of things. Oncological treatment, chemotherapy, radiotherapy, immunotherapy, and other treatments that could produce fatigue, vaginal dryness, decreased vaginal elasticity, lack of sexual appetite, pain, early menopause, difficulties in reaching orgasm, and also erectile dysfunction are usual. Also, consequences of surgeries and other physical changes can occur that could produce low self-esteem, low mood, also isolation pain, rejection of physical contact, less irritation of the affected area, also dyspnea. Also, the emotional status of patients can affect the sexual area, anxiety and depression that could produce apathy, lack of desire, difficulties becoming aroused, and also reaching of orgasm. We also must take into account the patient disease status, the existence of an habitual partner, sexuality partner, because we must take into account also the communication difficulties that could occur during the disease, mistaken beliefs about sexuality, also feeling of isolation, infertility, also personal sexual history that could affect the way that we manage with sexuality during the disease. Lung cancer and sexual dysfunction are frequent. Dysfunction or discomfort will appear related to the different phases of the human sexual response. We are talking about desire, arousal, orgasm, and also pain-related dysfunction are so usual. So we are talking about all of this. Sexual desire. When we talk about sexual desire, we are talking about interest, we are talking about predisposition, we are talking about erotism, we are talking about fantasy. In this phase, lung cancer usually have the perception of uninhibited sexual desire. It's so usual. And it could be affected by oncological treatments, also repressive education, poor and unpleasant sexual experience, and pain experience, also couple problems, and also psychological factors like anxiety and depression. How to restore sexual desire? First of all, we must start accepting your body. Your body probably has changed, but it could still offer you good moments and feelings. Erotization of sense, using your imagination to give your pleasure, reconstruction, your sexual fantasy, it's so important. Your imagination probably is your best way to start to enjoying. Think about what do you want? What makes you feel good? It's a very good point to start. Sexual fantasy is the engine of your desire and also of your arousal. If we don't think about sexuality, probably we won't think about sex. So let's start for the beginning. Sexual arousal is the continuation of desire, which are talking about pleasurable activity and maintenance over time. And to achieve this sexual arousal, it's important to be relaxed, to be concentrate on your feelings or on your sense, and also abandon to sensations. things that could inform you that you are achieving this sexual arousal are lubrication in women and preliminary fluid in men, erection in men, also general muscle congestion, and also blush. The dysfunction that could appear in this phase are lubricant and erection dysfunction that are very, very usual. And the causes of this dysfunction are the excessive focus on intercourse, also myths like that the erection is the only important thing to have sex, fear of failure worries, and also perception of disability after treatment. And how can we improve our sexual arousal? To start, give yourself permission to feel pleasure despite of cancer. And how can we do it? First of all, work your sensuality, your eroticism. Let's eliminate unusual, useless pressures. Also, think about intercourse. Probably it's not the best idea at first. Let's be creative. Enjoy your body and try. Practice also the positive egoism. What do you like? What excites you? That would be two good reflections. And also relax. If you are not relaxed, it is difficult to achieve sexual arousal. Orgasm is another phase, important phase, but not the only thing that we want to achieve in a sexual relation. The orgasm is related to the sexual tension generated with excitement. This phase also is related with dysfunctions like premature ejaculation and also difficulties to reach the orgasm. There are lots of myths related with orgasm, like it is necessary to have an orgasm to have a satisfactory sexual relationship. If don't have or provide orgasms, I'm not doing right my relation. How am I going to feel an orgasm with my disease? We must both have orgasm simultaneously. I think this might can difficult the relation. When we talk about premature ejaculation, we want to talk about also that it's related with the perception of little control over ejaculation, which causes usually discomfort and frustration. It is usually related also with a great focus on intercourse and a high performance of pressure, performance pressure, sorry. The reality is that it's not a dysfunction. As such, nothing goes wrong. So we should review prematurity concept. No? But if it causes discomfort to men, we should face it. How to manage with premature ejaculation. First of all, as I have said, we must realize that nothing is broken. Intercourse is not the only satisfying sexual practice, so be creative and try other practice. Play with your arousal. Sex is not a race. And make a reflection. No, you could use your self-stimulation to recover the feeling of control of your sexuality. And also relax, because we are talking about enjoy, we are talking about your body, we are talking about your relationships. First of all, is the most important thing. This is the most important thing. Difficulties on reaching the orgasm also are so usual, and lots of myths are related, and these causes are like best orgasm is achieved through intercourse, but but also these problems could be related with traumatic experiences, couple conflicts, and also a lack of knowledge of anatomy or adequate stimulation. And how could we do it with these difficulties? What could we do? Relaxing is the first step to get this orgasm, positive egoism, excitement, and also surrender to sensations. Important to look your genitals. Do you know your genitals? Do you know your anatomy? It's very important to achieve this orgasm. Avoid myths. Read, investigate about this to contrast this information. Intercourse is not the best practice to achieve orgasm in most of the women. So probably it would be interesting to be creative and enjoy other practice another time. Sensuality and self-stimulation would be good ways to achieve. Pubococcygeus muscle training, also Kegel exercises would be a good way to improve this capacity, work desire, and also excitement, and also self-esteem and autoerotism. Vaginismus and dyspareunia are also so frequent in women with lung cancer. And when we talk about these dysfunctions, we are talking about an involuntary contraction of the muscles that surround the vagina that try to prevent the introduction of objects, fingers, or also penis. That could be, could cause dyspareunia, pain experience. You should remember that pain is neither good for and not normal in sexual practice. Pain is contrary to orgasm, excitement and pleasure. So we must work on it to prevent. Vaginismus and dyspareunia could be caused by traumatic experience. Disease could be one of these kind of experience. Also, the lack of knowledge about your genital anatomy, and also wrong beliefs about this. Vaginal stenosis, changes in the morphology due to radiotherapy, chemotherapy, immunotherapy, and also surgical treatments. Vaginal dryness, menopause, and also other biological causes that could be assessed by gynecology. And how to manage with these problems? First of all, reappropriate our body, doing Kegel exercise that you can try it. There are contractions of your muscles of your vagina, and you could be assessed by a professional, by a specialist. Break false beliefs, experiment with your body, try, imagine and be creative. It would be so interesting to do pelvic floor work with physiotherapy. And also remember to use lubricant in all of your relations. Also, I want to suggest you to use dilators, but probably I suggest you to training follow up by a specialist. For the end, I want to suggest you let us give importance to the recovery of your quality of life in all spheres of your life, also during cancer, during lung cancer. Consult your doubts with your oncologist and also with your psycho-oncologist or your sexologist. I encourage you to recover your sexuality. What are we waiting to talk about sex? And to contact your psycho-oncology and your expert of oncology. I suggest you to do it. So thanks very much for your attention.
Thank you so much, Fátima. I think I have taken a few notes during your presentation. I think it was pretty interesting. And one of the key learnings here is the fact of, is the fact that you mentioned that probably sexuality goes beyond sex. So there are a lot of factors that are involved in here, and it's not just about the physical thing. It involves a lot of things like communication, like understanding with your partner, but at the same time there are a lot of things that probably because it might be shyness, because sometimes it's something which is not considered important, but many physicians are not included in many multidisciplinary teams, can be a real challenge for patients to talk about. So I think you raised very, very good points. I gave us a very good floor for our next part, which is about a little bit of how I wouldn't call it like a Q&A, but more like a kind of dialogue. So it's great that we have you, Merel, here, and I'm very grateful for your generosity to be here and to share your experience and your thoughts in this particular topic, which I know it's something which is very important for many people who's impacted by the disease, but sometimes it's not properly being talked about and so on. So I would start by asking you about your experience. I understand, because I have very many times, that at the time that you are diagnosed, it seems that your life's completely changed. But specifically when it comes to this sphere of your life, how this had an impact in your life, how were things at the time of diagnosis, and how have you been able to manage and cope with it throughout your journey, which is now like almost 10 years, but I understand there has been many different stages. So So what about that, Mara?
Yes, well, when I was diagnosed 9 years ago, everything was about survival, and everything was clinically approached by the doctors, etc. So our feelings were not, they were not important in the hospital, because the tumor, that was important, and not and I was just the body around it. It seemed like that. For me, not the anxiety of depression, but the shame that my body had failed me. So I'm rather competitive in my life. And I always want to be on top of my game. And suddenly I had lost, because I got sick. So I felt kind of ashamed of who I was, and my body had failed me. So I didn't like my body, and I had a strong aversion towards my body. And in the first years, survival was key, and everything in it. And for me, sexuality is more intimate, being intimate with my spouse, and for me that was more important than for him. So communication is very important. It's key, I think, because the desires are different, and I got from the first part of being ill right in menopause. So it's not ideal. Let me say so.
I can understand that. Before going to some of the questions that we have received from the audience, because I understand from what you are saying that one of the main things was like something that Fátima was mentioning was the loss of some self-esteem, and the way that you perceive and value your own body, your own image, that was preventing you for, coping with this part of this dimension of your life. Another question I would like you to do, because I know from Luce, when we have explored some of the impact of the disease on patients, we saw that this is quite an important issue, especially I would say in younger population, but especially for everybody when it's about self-esteem, body image, and sexuality. I wanted to ask you, Merel, when you have these issues, did you have any chance to have support from the health system, or was anything offered to you to really cope with this particular? Not at all.
No. The part that the holistic approach of people, of patients, well, it's quite new. I think. I hope. I hope it's now part of the program at the doctor. But also, you're not going to speak to your oncologist about your sexuality. And you don't speak about it because he said, oh, the tumor shrunk, or you're doing clinically fine. So for me, it's important that you have some kind of specialized nurse where you can talk about sexuality, about finances, about depression, etc. And she can refer you to a psychologist or a dietitian or something. So, but you need someone who is safe to talk to. And your oncologist always is not that safe because he always brings you the bad news as well.
I understand. Yeah, this is, sometimes I think I have the feeling that when we speak about having a multidisciplinary care team, we're speaking a lot of things, but at the end of the day, it's having enough a space of confidence and trust where you can share these kind of things who are going to have a major impact in your daily life, and especially, well, this is one of the things you mentioned in others, like physical rehabilitation, like diet, like nutrition, and at the end of the day, to keep as much autonomy as possible. I'm gonna start with the question that we were received, because Fátima, you were speaking about myths, and not only myths, but also about lack of knowledge about certain aspects that can really have an impact. So one of the questions that we received were about whether the cancer treatments can harm your partner during sex. So the fact of you receiving a hard treatment, like could be chemotherapy or targeted therapies or immunotherapy, if I'm receiving that treatment, can I harm my partner during sex? So is it true, or it has nothing to do with it?
Well, Alfonso, it's a question that a lot of patients make in psychological and psycho-oncological session. There's no reason why cancer treatments can harm your sexual partner. Sexual intercourse also is it's not contraindicated during cancer, during lung cancer, or during treatment, but perhaps it is appropriate to adapt the sexual intercourse to ensure a sense of well-being for patients, just for avoid pain, or to prevent pain, or to achieve the best well-being during the sexual relation. In relation to the possibility of pregnancy, we must be pay attention. During the treatments, it's highly recommended to use preventive measures, so to avoid the possibility of pregnancy during treatment, because this possibility could be risky for the baby, or harmful in this case.
Can I make a
sure,
comment?
Merel?
Because you said that a lot of side effects are related to the treatment that you get, but a lot of stage 4 patients, like myself, we get the lifelong treatment, so it never stops. So there's there should be a way to look at it that the side effects will go down or something.
And yeah, that's something that is probably a good point, especially when it comes to oncogene-driven types of lung cancer in which you are going to receive oral medication for years and years, it would be really good to have a consultation with, in this case, with the oncologist to see how this can be managed. And I also, you mentioned one interesting thing, which is about basically the possibility about getting pregnant and how this can have an impact in the fetus or in the future baby. So I know that some patients are being offered to froze their sperm or their eggs before starting treatment. But sometimes we have realized from some of our reports that this hasn't been always offered to all patients before starting treatment. So, Mara, may I ask you what this is something, I mean, in your individual experience, but also being in touch with some other patients through the patient groups, do you know this is something common which is being offered especially to younger patients, or there is still a lack there?
Well, all the patients I know are stage 4 diagnosed. So the doctor will never say that they will be cured or something. So they don't recommend getting pregnant.
I see. And in your practice, Fátima, because I know you work together with many oncologists and you work with many people impacted by lung cancer and so on, is this something which is commonly offered to them? Or do you think that there are still a lot of doctors who are so focused, especially as Merel said, when you are with an advanced stage of the disease, like a stage 4, they just focus on trying to reduce the size of the tumor, and they don't pay so much attention in things like the possibility of younger patients becoming pregnant in the future or fertility issues or things like that. What's your experience?
In my experience, I think that we are still so focused on the treatments, on tumor and how it's going, and there's a lack of information about how to manage with preserved fertility. I think that there's a lack in Spain when we talk about lung cancer, especially. I think there's a lack of information from the oncologist to the patients. Yeah.
And this is probably a good point for us to take into account, especially when advocating for these type of things to provide a better care for people who have been diagnosed with lung cancer, because it's something that we're seeing that it has an impact not just in the patient itself, but also in the partner, in the family, and so on. Yep. So there is another question that I would like to send you first to Fátima and also to Merel, which is but how one patient was asking us, how can I cope with my with the changes that are happening in my personal relationship after my lung cancer diagnosis? We all know that, you know, the shocking news of you've got cancer has a lot of impact, and this has an impact with your partner in case you are in a relationship. So how do you think is the best way to handle, or Merel, in your opinion, also from your experience, how do you think you can deal with it? I will start with Fátima.
Yeah, Merel has talked about it. Communication is the key. It's the best tool for both members of the couple to adapt to changes. After the diagnosis, priorities change, plans change, and also roles in the couple change. So the key is to identify new needs of each other, to continue helping each other, to continue living as a team, and to helping each other with the needs and the problems that could appear after diagnosis or during treatment. I think that the communication also it will be the key, a good communication.
Yeah, we became very communicators after I got sick. Before that, we didn't communicate that much, but after I got sick, we had to, because the roles were changed, even in the household with our 2 young children. So everything was upside down, and we had to become a couple again, and well, it's hard work, let's say that. But it's worth the while if you are ready, really investing in each other.
How can your partner know how to manage with this if you don't give the support to do it or give the information to support you?
And that's absolutely a great point, which I think is communication. And I'm going to play the advocate's devil role here. And I would like to ask you a question because, and it's probably something that I perceive as a man, that sometimes we are, I'm being like generalistic, so please nobody take me wrong, but sometimes for us it may be a little bit more difficult to communicate or to understand or to touch, especially I'm thinking about certain regions, certain parts in which we are still not like a taboo, but we tend to be simpler in some kind of way. So even communication between the partner is something which should be in place in an ideal situation. If this situation is complex, you mentioned the sexologist before, Fátima, or which other professionals or players can help the couple or the partner to really be more, let's say, to improve these communication skills, to go through a pathway when there is a need of external support. You mentioned the role of the sexologist or the psycho-oncologist. So would you recommend everybody going through these communication issues to record to one of these healthcare professionals to really try to manage and go better with the issue of sexuality, with sexuality issues and so on?
Yes, and also your oncologist, your nurse, because all the professionals could offer you information and more knowledge about the disease situation, the disease process, to understand better and to help better your partner. And the support should be not only in one way. No, your partner also needs support. Patients may also offer support to their partners to understand the situation.
I see. And Merel, also, I'm asking you now to change your hat as a patient advocate, because I know you are related with many different patient groups, patient communities, and so on. How do you see the role of these patient groups and patient associations in order to provide this type of support or information to people who has been diagnosed with the disease or their couples, their partners?
It's not a topic that is discussed within the patient groups. I think it's still kind of a taboo or something. I learned a lot from you, what you can do, because a lot of patients, when they have troubles, when they have problems with sexuality, they say, well, it is like it is, and so they adapt to it or something, and they don't know that there are some guidance that they can get to improve their own sexuality, but it's not a topic within the patient groups.
Yeah,
let's start talking about it.
Yeah, and I mean, at the same time, I consider this like a kind of good and bad news. And let me explain. I think it's a bit new because it's not being discussed. But when I think when I first started listening about lung cancer, it was like the survival rates were so poor and everything like that, that this was not a topic of discussion, but it's gaining a lot of more importance. I think, Merel, you are a great example. You are in good shape. You're super active 9 years after the diagnosis. So it is great to raise these needs, and as part of patient organization, I think this is a gap that we should really cover and think about how we can really work to be a hub or a nexus for many people to start these discussions and start supporting them when it comes to sexuality and to how to improve this interpersonal relations. So I'm gonna go with the next question, which is something about self-perception. The question was that after my lung cancer treatment, I see myself differently due to some changes in my body shape and due to the fatigue. And I feel many times upset and sad. what can I do to better manage this new stage in my life? So, Fátima, I will start with you first.
Okay, thank you, Alfonso. This patient is talking about depressive symptoms. So as we talk about depression, could affect our sexual activity, our sexual desire. During cancer treatment, the body makes a great effort to assimilate intense and hard treatments. After this stage, patients may also have to make an effort to live with uncertain, with sequels, and also to accept themselves, look for strategies also to help to feel them good. And I think that in this stage it's important to first take the professionals closely and to ask them doubts and to look for support and information to spend this time as with a sense of well-being. And I think in this moment, accept themselves, to look for strategies. It's a good idea with the professionals, and also to help their partners to understand these changes and seek psychological help to overcome this stage. I think it would be a good idea, and also to allow themselves, to give them time and help them to recover this area.
Giving yourself a little bit of time for acceptance, because that can be hard at first, could be a good, and also to seek for support if you feel you are prepared to have this conversation. Merel, in your personal opinion, how did you find this when you were diagnosed, and you know you have had such a long pathway, a long journey, so I guess there has been ups and downs in different parts, so I guess it's not just it has been changing throughout the time. So how did you feel coping with these different things, like impacting in your health status, in your physical status, in your self-perception, and how would you what would you also recommend from your perspective as someone living with disease?
Well, first of all, if you are looking at the patient, he gets a death sentence, he gets treatment, which is very invasive. He gets, if you're a lung cancer patient, a lot of guilt from other people. He gets the uncertainty of having a life. So it's hard work to be a patient, and the patient should need to get all the support that there is, not just the clinician who gets the tumor treated, but the patient should be treated as a whole human being. And also the caregivers around it, the children should be treated, the partner should be treated. So, and if you are if you don't have to ask for help, but if help is being offered as a standard of care, for instance, I think patients could have a lot easier way of living with a cancer diagnosis, because it's part of the treatment plan that your mental health and your physical health is also being treated, not just the tumor. So yeah, an holistic approach, I think.
Yeah, and basically treat a person like a person, not like a mix of organs, let's say, or like treat the person, not the disease. That's a good tip. So we have a few minutes left, and before ending the session, I would really like to hear from you, like a kind of final message to summarize what we have been discussed, today. So I'm going to start the backwards. Merel, so if you would like to have in like 1 minute, send a message to summarize what we have been discussing today before we close the session, the floor is completely yours.
Okay, well, my message would be for patients that you're not alone in this feeling, in this anxiety and depression and the body shame sometimes. So if you know that you're not alone, it's more easy to ask for help. And if you are afraid to ask it, your oncologist, ask the nurse, and they know where to send you and where you can get help. Something like that.
Thank you, Mara. And Fátima, if you would like to share final thoughts or final words with our audience, it would be great.
Yeah, I want to tell the audience to accept yourself, to look for information, I want to tell you also that you are not alone. The patients are not alone. That there are a lot of professionals surrounding that could offer information, support, and treatment to a lot of dysfunctions that could occur with lung cancer. Your sexuality is also important. So let's give this important and look for information to recover this function and to recover your joy and your pleasure and your life.
Thank you so much. I take that final message that sexuality and sex is also health. So
Yep.
let's put this as also a priority. Having a cancer doesn't mean that you can keep on enjoying things in life, and also pay attention to those aspects that can make a difference. So thank you so much. So with that, I'm going to close the session. But before that, I would really like to thank you very much, both Fátima, for giving your expertise here. It's been great to have you here, and with that, and Merel also for sharing with us your view and your generosity to talk about this topic. I think this can be something very touching for many people who is going through this situation like a lung cancer diagnosis, which we know is rough, but you know what we pretended with this session was to support them and to show them that there are always places to really improve the life and the way that we cope with the disease. So thank you so much. And before closing the session, I would really also like to thank all of you who are watching the webinar. So thank you very much for attending. Just keep in mind that the full session will be recorded and uploaded to our YouTube channel. We will be reading your comments, both in for those who connected to Zoom, but also those who are following this session in our social media channels like Facebook, LinkedIn, YouTube, and Instagram. And I also suggest you to have a look at our website, which is www.lungcancereurope.eu, and especially in the member section, so you can see and find your local association, just in case you haven't been in touch with all the patients and caregivers. And we are here at your disposal. So without anything else to be said, I wish you all a very good evening, and I really wish you to meet you again in our upcoming webinars and online sessions. So thank you very much, and once again, thank you, Fátima, and thank you, Merel, for your time today.